Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is August 21st, 2020. We'll start as always with the COVID statistics. Worldwide, we have over 23 million cases and over 800,000 deaths. In the United States, we have nearly 5.8 million cases and almost 180,000 deaths. This week, COVID-19 became the third highest cause of death in the United States for this year. It's only behind heart disease and cancer. Some projections estimate that by the end of the year, the United States will have reached 300,000 deaths, but that's still only about half of what heart disease and cancer each cause every year. So the chances of COVID-19 going above third place are slim to none. Anders Tegnall, Sweden's version of Dr. Fauci, has been speaking up again this week. You may remember that we talked about him and Sweden's response to the pandemic a couple of months ago. Basically, their response was to not respond and just let the virus take its course. They later regretted that choice when their cases increased dramatically. Well, Dr. Tegnall is now in the news for saying that face masks aren't important and could even be dangerous. It makes for a great headline, but when you read what he actually said, you realize that even though he's come to a different conclusion that is very different from most health organizations, he also makes a good point about face masks. That point is that face masks should not be considered the ultimate weapon against COVID-19. They are an important part of our response to COVID-19, but it's also critical to follow the other recommendations such as social distancing and washing hands. While studies have shown that face masks are very effective at slowing the spread of COVID-19, they are far from foolproof. Many opponents of face masks, including Dr. Tegnall, argue that wearing face masks could encourage people to ignore other recommendations such as social distancing. While this could possibly be true, their answer to just not wear face masks at all is kind of a weird solution. Why would we dismiss one of the best protections we have against COVID-19? Also, wearing a mask not wearing a mask doesn't automatically mean that you're going to follow the other things, like social distancing and washing hands. In fact, here in the United States, it seems that the majority of the people that refuse to wear masks are also the ones that don't practice any social distancing. So, yeah, that doesn't help. Since we know that masks are effective, the solution that makes a lot more sense is to just educate everyone about the importance of following all the guidelines. That's why you'll see many health departments pushing a campaign of 3 W's. Wear a mask, wait at least 6 feet apart, and wash your hands. I've also seen the social distancing W referred to as watch your distance. Recently, the public health community, including us here at Plain English Public Health, has been guilty of focusing a bit too much on face masks and not as much on the other guidelines. Part of the reason for that is the controversy surrounding masks and our desire to set the record straight. We are all starting to refocus on a more balanced approach, and so hopefully that'll help influence people to make better choices here in the near future. We've also been accused of wanting to restrict freedom by requiring the wearing of masks. But there are a lot of things that are wrong with that accusation. First, wearing a mask isn't a limit to your freedom. It's actually helping to ensure that we don't have to go into lockdown, which would definitely restrict your freedom. Second, Americans, including public health professionals, generally don't like limiting freedom and take suggestions to do so very seriously. Lastly, most public health professionals actually consider it a failure when a mask mandate or a lockdown needs to be enacted. We strive to view issues from the viewpoint of those we are helping because it's all about education. We try to help people help themselves. And so when we take a look at their viewpoint, we see ways that they think it needs to be fixed, and we try to implement those steps to fix the issue in the most acceptable way possible for those we're helping. In the case of COVID-19, we're trying to do the most effective things that still allow everyone as much freedom as possible. The initial stay-at-home orders were based on the limited information that we had at that time. Now, with much more information about COVID-19, we've realized that following the 3 W's can reduce the spread of COVID-19 without resorting to lockdowns. Please believe me when I say that the vast majority of those in public health do not want mask mandates. We do not want lockdowns. What we want is for people to voluntarily take the simple steps that we know will make a difference. We only recommend more stringent measures when we've lost hope in the people we're trying to help. And that's really quite a sad reality. In other COVID-19 related news, the CDC has stated that the infection rate among children, not just the total numbers, but the actual rate, has risen steadily since March. We talked about children and COVID-19 in last week's weekly report, so if you want more information, please go back and watch that report. Another thing we've talked about in past reports is how COVID-19 can affect the whole body, not just the respiratory system. This week, we've got even more evidence that COVID-19 damages the heart. In fact, researchers are saying that the virus can infect the heart itself, not just the lungs, but it can actually go into the heart itself and cause clotting and heart disease. Some studies found that more than half of the patients examined had heart damage of some sort. It is believed that much of that damage could be long-lasting. This news just underscores the point that we've made multiple times in past reports. The death rate is not the only dangerous part of COVID-19. There are many other short and long-term effects of catching COVID-19, so we all need to do our part to slow the spread. One good bit of news this week is that more studies are being done regarding gaining immunity to COVID-19. These studies still can't tell us how long immunity lasts or how well a specific vaccine will work, but we are much more certain now that people do gain immunity no matter how mild or severe the infection is. It also appears that multiple parts of the immune system are activated, so even if the antibodies diminish after a few months, other parts of the immune system could still protect us. Enough about COVID-19 for today. In other news, Germany is starting an experiment this week that will last for 3 years. They will be trying to see how a universal basic income affects people. A universal basic income means that the government gives a specific amount of money to every person or family in the country every month or week or other period of time. It's been a political hot topic in the United States recently, but it could also have a strong effect on public health. Supporters say that it would help reduce poverty and increase equality. Opponents say it would cost too much and would discourage people from working. There haven't been many studies about this in the past, or about any type of giving money to people. There have been some. You can see links down below the video for details on a few of those. But the few that there have been have mostly shown a decrease in poverty. There are always some who just take the money and run, but the vast majority of those helped in those previous studies actually use the money to improve themselves and those and others around them in order to make their lives better. They use it for education, they use it for food, they use it for starting a new business, things of that nature that actually help not just themselves and those around them, but also the entire country. It raises the entire country. The German study would only involve a small group of people, not the whole country, and the money that is being used for this has actually been gathered through donations, not from the government itself. So hopefully in 3 years, however, even with these limitations, hopefully we'll know more about whether universal basic income works or not. We have a couple more recalls this week. First off, hand sanitizers, still an issue. Keep, being careful about the hand sanitizers you use. That's just an ongoing thing. But in addition to that, we have a couple more recalls. The first is related to the onion recall we mentioned a couple of weeks ago. Those onions that were recalled were also used in some other food products, like salsas and cheese dips. So those foods may also be contaminated with salmonella. Please see the link below the video to determine if the food that you have in your house is safe. Also, the second recall is also about salmonella, but this one deals with peaches. There were some peaches that were sold in Aldi stores beginning June 1st, and those have been recalled, so please see the link below for more information. Finally, this week, we'll talk a little bit about a popular diet choice, the ketogenic or keto diet. Recent studies have given conflicting evidence about that diet, and the jury is still out as to whether it actually works for weight loss or not. And that's not really the reason we're talking about it today. What we want to know about the keto diet is about how it works to treat specific illnesses. A very strict version of the diet has been used for treating epilepsy since the early 1900s. Recent studies suggested it could possibly be used for treating Alzheimer's disease, ALS, Parkinson's disease, migraines, inflammation, and even some types of cancer. Scientists stress that more research is needed, and the keto diet can have negative side effects. So always speak to your doctor before making any dietary changes, any major dietary changes, such as switching to keto or any other major diet. Thank you for watching the Plain English Public Health Weekly Report for August 21st, 2020. I'm Richard Greenland, and you have a healthy weekend.